Dr. Whitfield has been a plastic surgeon for over 25 years and specializes in breast implant illness, breast implant removal surgery for explants, and advanced cosmetic procedures such as his no-cut facelift. He has performed over 3,000 explant surgeries to date. In addition to his work as a surgeon, Dr. Whitfield developed the Strategic Holistic Accelerated Recovery Program, also known as SHARP, a series of protocols to help reduce systemic inflammation and assist patients who are preparing or recovering from surgical procedures, cosmetic or otherwise. It's a pleasure to welcome Dr. Rob Whitfield to the show. Dr. Whitfield, welcome to the show. I'm so excited to have you. You were with one of my favorite people this weekend, JJ Virgin, for her summit. I was so bummed to miss it. I really wanted to come this year, but I was coaching a soccer team and I had to be there for the littles. But fingers crossed for next year. I'm going to carve it out and hopefully we can meet in person.
Well, thank you for having me. I really appreciate both what you do, and I hope that sharing this information that we've written about, published, and experienced over the last 8 years with breast implant illness is very valuable to your audience.
No, and that's why you're here. For those of our audience members that don't know who you are, Dr. Rob Whitfield is, I would say, the expert, the premier expert in breast implant illness, in studying it, in talking about it online, and making everyone aware of it as an actual illness with symptoms and side effects. And so that's what we're going to do today. We're going to unpack breast implant illness. What is it? Why does it happen? You've been a plastic surgeon for over 25 years, putting implants in and now taking them all out. So let's unpack it.
Yeah, sure. For your audience, I did and performed oncologic or cancer reconstruction predominantly throughout my career. That was my passion. My sister was a breast cancer survivor until recently this year. She passed away. But taking care of women with breast cancer and or problems that developed after treatment, and because implants are a foreign device, they're going to have more problems than your own tissue. So basically what I did was an elegant operation called a DIEP free flap, and that used the tissue of the lower abdomen and it maintained its blood supply. And then we revascularized it on the chest in a way that would allow us to create a natural holistic breast form that we could add to with fat transfer. So I've done many thousand free flap breast reconstructions. I've done many thousand fat transfers for that patient population. It's near and dear to me. And then because of a cancer patient who I explanted in 2016, I found that she had a hidden E. coli infection. She put me on a Facebook group for explant surgery, which I didn't even know was a phenomenon at that time. And 8 years later, we've published a recent paper regarding the bacterial contamination in the scar tissue around breast implants. So that's the patient's scar tissue. And in 29% of the patients in my study of over 600 samples, it's predominantly Cutibacterium acnes, a bacteria found in obviously acne and on our skin of the face, neck, chest, and shoulders, and Staph epidermidis, which everybody's heard of, the staph that's in our skin. And recently, a scientist showed that the interaction between the bacteria in that tissue around the implant and the breast tissue, specifically a fatty acid called oleic acid, interaction by those two causes a molecule called oxylipin 10-home. I know it's a lot of stuff, but what you have to remember is the interaction of the bacterial biofilm with the fatty acid in the breast causes this molecule to, through an oxidative process, be formed. And that goes on to stimulate a woman's immune system and lead to the symptoms of things like fatigue, joint and muscle pain. So anything that ramps up your immune system changes how your T cells work, how your macrophages work. That can cause what many people associate as an autoimmune phenomenon. So autoimmune diseases have predated implants. In the late 1800s, autoimmune diseases were first being identified, and the first implant was placed in Houston, Texas in 1962. So those two things obviously are different in terms of timing. What I want everybody listening to understand is there is scientific evidence to support why a woman who has a breast implant can have a problem. And these are the biomarkers that eventually we'll be able to look at more carefully outside of a research environment to show that. But there is no confusion about what I've seen. I've known this for a period of time. And this scientist, Dr. Mithun Sina at Indiana University Medical Center, demonstrated this in a very elegant research project that's been published. My data has been published. There is no commentary about this not being a real problem with scientific evidence anymore.
So I have so many follow-up questions. When you talk about working with patients, I worked in breast cancer for 8 years prior to going back to school for nutrition. I saw a lot of lumpectomies, double mastectomies, prophylactic double mastectomies based on the BRCA gene. A lot of them came with implants or some type of reconstruction. Your type of reconstruction without an implant versus an implant, would there still be a chance that someone would have this bacteria and a bacteria's biofilm coming in contact with that fatty acid just because it had a surgery in general? Or is that a breast implant illness only specifically to the implants and the scar tissue that surround it?
So whether it's a hip, knee, breast, cardiac, dental, neurologic, spinal implant, whatever the implant is, it could get a bacterial contaminant and develop a biofilm based on the bacterial contaminant. Okay. So I used to get patients sent to me specifically for that other operation, the DIEP flap, which I no longer do. So please, I that's passed me by. I'm old now. That operation, because it's your own tissue, your own genetic material, and it reestablishes blood flow, would tolerate biofilm because it would be able to be cleared through your natural immune system and or antibiotic therapy. When you leave capsular material, which is why I'm very adamant about removal of that material, both from an oncologic standpoint to make sure there's no evidence of recurrent cancer, but to make sure you clear anything from a contaminant standpoint out. That's why I do it that way. So whether you're saying it's on block, intact total, total capsulectomy, those are acceptable, in terms of removal of all the material. And then let's just go ahead and point out the issues that people get told are, from a patient perspective, people are scared because they're told that's unsafe or potentially you can injure the lung in that surgery. So the lung is encased in 2 layers. One's the visceral pleura, one's the parietal pleura. If you violate the parietal pleura, that will collapse the lung, but it doesn't injure the lung. As soon as you evacuate a little bit of air out, the lung comes up, it's fine. So in the first 1,000 cases I did, I had about 4 or 5 of those instances that we repaired. The patient left the operating room. There were no other instances of issues. They didn't need to be hospitalized. So in terms of, is that a acceptable rate? Well, it's well below 1%. So yes. And is it something that should dissuade you from capsulectomy from a surgeon's perspective? And if you're uncomfortable with doing that, then you shouldn't be doing that as a surgeon.
Yeah. I'm going to back it all the way up because I feel like my audience wants to understand I'm sure there are people tuning in that have breast implants or are considering breast implants. I want to inform them as to what these implants are made of, what are the consequences or side effects of having an implant put in, and then what are the options in removal. Because you mentioned capsulectomy, and I don't know. I'm a novice to this. I don't have breast implants. Like I've seen friends of mine have explant surgeries and talk about how great they feel. And then I have friends who have implants and have not connected any symptoms to what they might be feeling. And they don't think that has anything to do with breast implants. So can you walk me through what are the side effects or consequences of implants? What can happen? How often they need to be changed? I think there are some of my friends who've had them for well over a decade, and some who say you have to get new ones all the time. Can we talk about all of the factors here so that we can
Yeah, I'll give you the patient journey. So the
Okay.
patient who comes to me usually is coming to me because they don't feel well.
Right.
So why don't they feel well? Typically, they're suffering from a host of, we'll just say, inflammatory symptoms, and we'll start from head to toe. So they could have headache, brain fog, light sensitivity, sound sensitivity, dry eyes, sinusitis type symptoms, a non-productive cough, difficulty swallowing, chest pain, shortness of breath, pressure, tightness. They can have arm pain, whether it's muscular or joint pain. They can have neurologic pain in both the arms and the legs, vibratory type symptoms, shooting pains, shocky pains. So those are the nerve pains. And then from the GI tract is a very interesting problem in my patients. They can have swelling, cramping, bloating. They can have constipation or diarrhea. They could just have fluid retention and be just puffy. Mm-hmm. They can have problems with recalcitrant or refractory or recurrent UTIs, bacterial vaginosis. They can have PCOS, endometriosis, bad periods. They can have proctitis. They can have, a horrible skin rash, psoriasis, athlete's foot. I mean, if you come up with something, I've seen a patient with that problem. Yeah. So what we're talking about then is chronic inflammation, and the patient happens to have a breast implant.
Mm-hmm. And are you looking, sorry to interrupt you. Are you looking, when you do like a blood draw, are you looking at specific inflammatory markers like high sensitivity C-reactive protein, interleukin 6? Are there any ones where you're like, I'm calling for these, I believe you and your symptoms that you're having, but these are also things that I'm looking for, or anything like that to confirm, or mostly is explant?
That's typically the next step. The people who come to me have already done all of that.
Okay. And
they've found nothing.
Okay.
For you to have an elevated SED rate, CRP or interleukin 6, LPPA 1 or 2, or any of those things, you have to have a really deep kind of problem. Mm-hmm. And that is typically not what we see in this patient population. So it gets to be even more confusing from a provider level, because you do all the things you just said, you look at them and you go,
they look fine. Yeah.
Those labs are fine. They're within the reference range and the normal limits. Still doesn't explain anything that you see in front of you. So then it becomes, what is not apparent is the genetics, right? So everybody has a genetic ability to detoxify a substance. And that's mostly through our liver, but whether it's vitamin D pathways for immunity, methylation pathways, glutathione utilization, or antioxidant pathways, those are fundamentally basic things that in my patients are limited if you audit our data. Mm-hmm. Then they many times, to make it markedly worse, will have estrogen toxicity. So they'll already have problems with PCOS and endometriosis, bad periods. They may have failed IVF multiple times. Then you go into their tox burden. And so we use a urine tox test to look at that. It looks at things like phthalates and glyphosates and BPAs and parabens and other, DDA, some of the bug sprays that are used, especially in places around, we'll say, a golf course or a community where they're concerned about that from a pesticide standpoint. You look at their heavy metal components. Now, every device has heavy metals in the shell. All the shells are silicone. Doesn't matter what's inside, whether it's saline or silicone. So there's only two types. We'll just say saline and silicone implants. Mm-hmm. The silicone implants are pre-filled, but each of them has a shell that has different heavy metal components in the curing process of the shell. So that'll become important later when we talk about detoxification and sauna use.
Okay.
So those are the two options that people come in with me to be evaluated for an explant. First of all, for everybody listening, I don't tell anybody they need to explant. Okay. Everybody who's coming to me has already made that decision And I'm trying to provide clarity around what we can offer in terms of prep, recovery, detoxification through my program and through the book we published, Sharp, about our process. So when we look at all those tests and we do a gut test, food sensitivity test, and a metabolomics test to look at specific, if you want to think of end products of chemical reactions like palmitic acid and glutathione levels, that will help us get a better gauge of what your body metabolically is doing. And then we do look at your hormones, because I find a lot of our patients have suppression of their sex hormones, especially testosterone, which is really important for recovery. So we craft a picture to create a detox plan. And then I have a whole group that runs that over the calendar year that they're with us. And then I put them on supplementation. Mostly that's liquid based. And the reason being is there's so many absorption issues in my patients that giving them more capsules to take or pills to take doesn't help them. And we really want to make sure that anybody working with us is getting the nutrients that we feel are most important to help raise the immune system's, ability to tolerate and help you, fend off and recover. That's basically, what we're trying to do. And then we create a surgical plan for each patient that involves, if they want an explant alone, like I just saw somebody before I got on with you, if they want to explant with a skin tightening lift or adding fat, all the things can get discussed and then and really branch off from an explant. But you asked like, when should someone have their implants evaluated, or what are the types of implants? And so there's some kind of specific things because of my background in cancer reconstruction and the use of implants. So when we would place implants, we just had a discussion around the 8 to 10 year mark about the increase in rupture rates. Doesn't matter if it's saline or silicone, they each increase about 0.5% per year after 8 years. So we would always make sure and counsel our cosmetic and cancer patients in my clinic about that. And then obviously it's not a lifetime device. There is no quote unquote lifetime device. Pacemakers get replaced, joints get replaced. That's why they don't like putting joints in really young people, because they're going to have to replace them. And similarly, when you look back at studies of cancer centers like MD Anderson, they'll say that the patients having implant-based reconstructions will go on to have more operations because it's a prosthetic device. It's not your own tissue.
Right. So let's dive into that external capsule on both a saline and a silicone implant. Mm-hmm. Like, what is that made out of? What is the toxic burden on a person who's walking around with implants?
There was a study that was published a couple of years ago that showed that when you break down that capsule, there's not a lot of heavy metals or anything in it. Mm-hmm. I think the issue with looking at certain studies is I have a bunch of patients who are super into biohacking and their health, and they use sauna. They may use a sauna that gets to 212 degrees Fahrenheit, like my client, Lauren Bostic on the Skinny Confidential. So she actually caused what's called chemical leaching. The actual substances in her implant shell started to leak into her system, and then you would find them on a tox test. And so I discussed this with her and her husband, and then we talked about it on her show. And then on her repeat tox test, all the cadmium and tin and aluminum and thallium and all these things were gone from her system. And she did no detoxification process. Mm-hmm. All she did was explant surgery. And then she felt better right away. And everybody listening, like having a really elevated tin level in your body is very bad. Mm-hmm. It can cause extreme neurologic problems. So just getting that out of your system can really help you from, say, a cognitive standpoint.
Mm-hmm. So when it comes to explant, what are the options of removal, and what are, like, I hadn't even really thought it through until I was excited to have you on the show. Like, if someone has implants in and then removes them, I mean, it kind of feels I'm nursing a baby right now. So it's like the day I stop nursing, it's like empty bags, you know? So what are you doing, and what are the options for someone? What's the difference between an explant surgery and a capsulectomy? Like, what are you finding when you cut someone open and you're looking to get that implant out?
Right. So everybody forms a scar capsule around every single implant, whether it's the hip, knee, breast. There's a scar capsule that forms, and that can be, very, very thin, like, a Kleenex, or it can be thicker, like a few pages of paper. Okay. And so it's not about taking out a lot of tissue. That's never our goal. Yeah. Most implants in the United States are behind the muscle, so you have to separate the muscle from the capsule and then take it off the surfaces of the rib. If it's above the muscle, then you're taking it off of the surface of the muscle and away from the breast tissue. Mm-hmm. So those are the technical components that the plastic surgeon has to execute. And what we're trying to do, just like I did for Lauren Bostic, you can listen to her show, like she was better right away because I took all the material out and it came out totally intact, undisturbed. Mm-hmm. So if those chemicals that had leached into her system were just trapped inside the capsular material, because she stopped sauna after I met with her, mm-hmm. then we take that out and that is not leaching into her system anymore. And in a short period of time, a healthy person with or without detox who can eliminate those toxins from their system will start feeling better and better and better. Their energy levels will go up. And we saw that, very clearly in her. So the capsule material can be thick or thin. It's always around the device. If someone's had more than one surgery, I do go look for the evidence of the other capsule material, depending on where it was. It's important not to leave things that could potentially be infected. I've had people from around the United States and the world contact us to have surgery to remove capsule that was left behind after an implant removal. Wow. So based on our study and published data that we know about biofilm, if those capsules have retained bacterial contamination, they can stimulate your immune system because it's still there. Mm-hmm.
For those who don't know, what is biofilm and why is it stimulating your immune system?
So I'm sorry, I'm using those interchangeably. So bacteria that go together, like a little village of bacteria, those form a community, and that's a biofilm. Biofilm is going to be protective of that community. So it makes it so your body can't really get rid of it. So it wants to, it's trying to attack it and get rid of it, but it can't. So your body stays in this really heightened state. I call it the hamster in the wheel. So you're just working really, really hard all the time and you're not going anywhere. That's why you get more and more inflammation. You don't feel well, despite, maybe all of my patients do a gluten-free, dairy-free, seed oil-free diet because I want to lower inflammation and raise the protein levels in their system to accommodate the needs for recovery.
Okay. So I'm imagining, and I want everyone else to imagine this like community of bacteria that's living in the surgical site that then creates like a little house or a roof over them so you can't get to them. And that's the biofilm. And so they're creating this inflammation and this problem. Your body's constantly trying to break down that roof or break down that house to get to them, to get rid of them. Clearly you go in, you pull out the capsule, you're removing as much as you can, anything you can see. And these are microscopic. So how are you breaking down biofilms to then get to the bacteria and break it down? Like, what's the process of getting someone ready for explant surgery and capsulectomy, and then continuing to support their body to get rid of that burden after surgery?
So we do, on a limited basis, detox with CellCore before surgery based on timing. I am not, and my team does not try to do biofilm busting before surgery.
Okay.
That's not going to work. You can't eliminate a biofilm on something that's not alive, in my opinion, because a prosthetic, knee, hip, dental, a breast implant is not alive. It has no blood flow. Mm-hmm. So when I take out the material physically, and then, we cleanse the area, that then gives the opportunity for the body and the providers to do all the detoxification work, because you haven't taken every bit of bacteria out of the body. If you just did a blood sample of somebody, they're going to have a lot of different bacterial and viral DNA in their blood. But in this specific area, we're intensely treating that at one time to remove that from the equation. Once that's removed from the equation, then we feel like the rest of your body will come back online and do its job.
Okay. Are you doing anything like PRP or anything at the site to improve like immune reaction, or is it mostly just letting the body do its thing? And then when it comes to like that area that is now empty, are you doing fat transfers at the time to improve aesthetics, or is there anything, is that like a multi-stage process? Like, how does that normally work?
So I think we got to address a couple things. A lot of people think there is mold in implants, and that is not a thing. So that's great for TMZ and all the other things on the internet that are undefeated, but that is not a thing. Okay. So in the show notes of this episode, we will make sure that the scientific paper regarding what is around implants is clearly known. So it's a bacteria. The most dominant bacteria in my study is Cutibacterium acnes, and the most dominant bacteria in the other study right now is Staph epidermidis. Those are the two in my study. 5 out of 1,000 of the first explants I did had fungi. 5 out of 1,000. Okay. So it is not a thing, and it should not be discussed as a thing, because bacteria are the dominant issue here. Now, the way to correct it is it will vary based on practitioner. I don't use drains in my practice. So we have a couple things we do to cleanse the pocket, and then we let the body absorb the fluid, and we leverage lymphatic massage. We have 3 devices from New Zealand that help promote a enhanced parasympathetic response and improve lymphatic drainage called Flowpresso. We have a hyperbaric chamber we put our patients in, and red light therapy as well as Nano V. So we have a lot of things specific to my program to enhance recovery. Now, in terms of revolumizing someone, which I just before I got on with you was having the discussion about, fat transfers. Okay, so we're just going to try to dispel all the nonsense about fat transfers. I've heard everything. So a fat transfer typically should have an order of magnitude of a 70 to 80% take or healing rate based on what you place it. How much volume you place. So the fat belongs in the fatty layer. So that's underneath the skin and above the breast. Mm-hmm. Right. So it's not in the breast tissue, because that'll make cysts and cause other problems. And we should highlight the fact that in the early 2000s, many studies were shown that this did not increase or cause a breast cancer. This did not increase or cause or delay a detection issue with breast cancer. So a very, very good breast radiologist will have no trouble with anything remotely confusing about a fat transfer. So let's just stop all the nonsense and hand-wringing about this. So you put it in that plane, but it's not meant to push the breast tissue out, right? It can't, because one, we're not putting it behind the breast. Right. We're putting it above the breast tissue, beneath the skin. So it's going to make it fuller, but it's not going to make the profile image project more. That's what an implant does. Implant, inanimate object that presses out.
Right.
So we don't put fat in the pocket where we took the implant out. One, in my study, I showed it could be infected at a pretty high rate, so we don't want to put it there. We do want to put it where it's going to help the most with the cleavage area and the upper 2/3, because that will look the most hollow after explant surgery. So that's where we want to help provide the most aesthetic change and improvement that we can.
That makes perfect sense. And so what would someone expect? Obviously, I think about lumpectomy surgeries that I was a part of, and they fill, like you mentioned, they fill with fluid, and a lot of times sometimes there's scar tissue, but the body kind of heals that over time. What can someone expect? Obviously, they're the most hollow after surgery. What are how long does it take for full healing, and what can people expect that cavity to look like, feel like post-surgery?
Yeah, so let's talk about mindset. So we talked about people coming in and they're telling me they want to have surgery. So their body may say yes because it feels so bad, but their mind may be like, I'm really not into this. I don't think I'm going to like how I look. So everybody listening, it's super important to get yourself in a good place, either through doing therapy, doing breath work, doing some reset, working with someone to help you, and having a supportive group around you is imperative in this process because it's going to be challenging. And no plastic surgeon is going to be able to solve that for you, less me. And I've got many thousands of patients, and 99% of them are great, but there'll be a couple of folks who get really stuck in a bad loop. And I feel for them, and we've tried to provide resources and educate them and refer them when necessary. But it's supremely important to work on yourself prior to showing up for this. So when you're in a good place and you're ready to do that, then it's the situation where you can do it. And I think, when you look at recovery, I look at it in 90-day increments because I'm looking for the long play, not the short-term situation.
Right.
Many of my patients are going to have a lot of recovery issues because of chronic inflammation. And even though we do our best to rehab them quickly, make everything more efficient, each person has to run that, race individually. So I really look at muscular recovery at like 90 days. So the chest muscle at 90 days. I look at recovery of tissue thickness in the chest, breast area at like 12 to 16 months, because sometimes it will take that much time for people to truly drop their inflammation, the burden, so to speak, the fluid retention, the feelings of being unwell, and then truly kind of turn the corner and start feeling good again. And then when you're feeling good again, you'll come in. It's obvious, it's pretty obvious. People are like, oh, I feel so much better. And, now everything's, I can do my exercise. I'm good with the appearance. It's changing. But when you're in the moment and it's every day, you're looking and getting caught up in that loop, it's very hard.
Yeah. And I feel like if you've gotten to a place where you've decided to, I don't know if maybe it was just the year, like around the year I graduated college, 2005, there were a lot of women who in their first job, first couple years out of college, were just going for it and getting implants without, none of this was out there. No one understood that there was bacteria around an implant, that you could have breast implant illness, that your body would need support to detox if you were to remove it. Like, this is all just coming to light, I would say, in like the last, you would tell me, it feels like the last 4 or 5 years to me, which you've probably been doing it obviously a lot longer than that. But it definitely, I could see how that'd have to be a mindset if you've looked a certain way for a certain amount of time to then commit to your health and then really not maybe feel like yourself after surgery, and to connect with who you want to be and what's most important, and make sure you're clear on that prior to an explant surgery.
I feel like that's, a piece of the puzzle that's very hard, for even a practice as devoted as ours is to taking care of this situation, trying to provide these patients with the best, safest place to have this done and recover. I feel like everybody, I've had therapy. My dad died during COVID. I just went back to work a week after that. I was not in a good space for a long period of time. So I did my own work, and that was super helpful. And you got to work on yourself in order to be able to perform at your best level. And if you're going to recover for something like this, you're going to have to do some work. That's a very underappreciated driver in recovery.
What is the SHARP program that you've created? It's a strategic, holistic, accelerated recovery program for unique challenges for surgery recovery and breast implant illness. Can you talk me through like what that program is and how someone can be a part of it and how it supports women post-surgery to get back to their like most vibrant self?
The SHARP method. We published the book recently, and you can get it on all the platforms. It's on Audible and Amazon and iBooks and Spotify. And the thing that I wanted to do was provide clarity around what I feel should be, the baseline of how we approach patient recovery after surgery by starting before surgery. Mm-hmm. So I really don't like responding to problems after surgery. I feel like if we just think a little bit more carefully and prepare, then many of the things that we encounter afterwards can be the degree of severity or inconvenience or dissatisfaction can be reduced markedly if we just take some precautions. So I like to know specific genetic things pre-surgery, how you detox pre-surgery, what you're facing from an environmental toxin standpoint, how your gut works. Because if your gut doesn't work, there's no chance you're going to heal in an efficient way. Now, we make some assumptions that most of my patients don't absorb well, and that's why we do the supplementation the way we do for my patients. Mm-hmm. And then fundamentally, we're looking at hormone balance, metabolomics, and food sensitivities, because the triggers in food can really affect how you respond and recover. If you can't get your nutrients, if you can't absorb your nutrients, your hormones, everything will become out of balance. And probably the most important thing I talk about in the book is sleep. So my patients have to sleep 7 to 10 hours after surgery, and women in general are not good sleepers. Mm-hmm. So many of them drink too close to bedtime. So I'll give you all some pro tips. So to avoid this, I need you drinking and eating earlier before you go to bed, not towards the time you go to bed. So if you want to follow a simple 3-2-1 rule, stop eating at about 3 hours before bed, stop drinking about 2 hours before bed, try to get the room temp down, because you need it down a few degrees to go to sleep comfortably. And you need to get off of your phone, your iPad, your whatever, because of the blue light, and try to get your lights going down so your body senses that and stimulates the release of melatonin, which helps you get off to sleep. Then to stay asleep and track your sleep, there's all sorts of things that I don't have any affiliation with, but Whoop straps, and we use ultra human rings in our office because I feel it's more accurate than an Oura ring. So that's ultra human ring. There's watches like Garmin's and things that will calculate your HRV and your deep sleep, but you're trying to get, like I said, that 7 to 9, you're trying to get the, 1.5 to 2 of deep. And then your REM can be 2, 2.5. Everybody's a little different. The deep is usually where all the magical things happen, where, quote unquote, the beautiful thing that happens in your brain, the lymphatic drainage of your brain happens. So that's really impaired in people like who have Alzheimer's. So you want that process to happen. Plus, that's when your growth hormone and all these things that are so important to recovery happen. If that reset doesn't happen, then you wake up, you may feel as if you didn't sleep well, or you may feel like you didn't sleep at all. You may have brain fog. You're going to be tired. If I have a patient tell me that they're getting tired in the afternoon and needing a nap, there's two things. One, the protein content in their diet is not high enough. So we use a plant-based protein, a pea protein in our line. And then we have an amino acid that we mix into, just water. And we're trying to get all of that higher so that your body switches into the healing or the anabolic phase more quickly. And then we're always trying to do things to lower cortisol. So, we're doing the lymphatic massage with more of a bend on parasympathetic, stimulation through heat, calming. We do hyperbaric oxygen therapy and like I mentioned, nano-V therapy. So that's really what Sharp's about. Like, what can you do pre-op? What can you execute? And then just do from a behavior standpoint, controlling your air quality, fluid quality, and food quality that you put into your system.
I mean, that makes sense to me. Healing in regards to like priorities, sleep, food and water, managing stress, upping protein. I think people don't really understand that protein is digested down into amino acids, and we take those amino acids to make everything in our body, from hormones to neurotransmitters to all of our muscles, tissues, and the enzymes we need to break down our food. I mean, it's pretty amazing. And most people, if they're not, I mean, you're using liquid supplements, if people aren't digesting their protein appropriately and utilizing those amino acids in the right way, that makes perfect sense to me that you would give them a protein powder or an amino acid supplement to make that a little bit more robust.
So let's go back to what Kelly said, because it's super important. Everything she said up until like protein digestion are all just behavioral modification. You're just trying to do a better job at sleeping and controlling the fluid, air, and fluid quality that you put in your body. Now, when we try to level up protein, I do recommend having some digestive enzymes to help with that, because I'm asking something that as you get older is harder for your body to do. So I'm 55, and every meal I'll have digestive enzymes because I mainly eat a high protein diet. I really don't eat carbs. I don't eat after 5:30 or 6 o'clock in the evening. That's the way I feel best. So, but I'm very, like, I will not, JJ's meeting, I missed an award I was given because I went to sleep, because I stayed on a central time zone. So I value sleep, and for myself and my family and my patients over all else, I prioritize sleep as the number one thing you can do to improve your health span, lifespan, and your recovery process.
And there is as a mom who went through a very sleep deprived season, there's nothing I value more in my ability to show up here in my office for my kids, for everyone. Like, it changes everything. So you're preaching to the choir. So it sounds like you're supplementing with easy to digest protein, amino acids, using digestive enzymes to break down your protein and support your digestion. Do you have your patients aiming for a certain amount of protein at each meal? Do you have them aiming for a certain macros to optimize recovery?
Yeah, so what we try to do, a simple rule of thumb, since the metric system is not so embraced in our country, is just think of a gram of protein per pound of body weight. So most of my clients are predominantly, obviously, female, and that's typically not what they would do. Although there's a trend towards a higher protein intake in my clients, I think they listen a lot before they come see me. So they already are making these adjustments to a higher protein, healthier fat, lower carbohydrates, no processed foods, no unrefined sugars, cutting out seed oils, cutting out gluten, cutting out dairy, because that's what I'm going to tell you to do if you want to work with me, because that reduces inflammation. And those are just behavior modifications that will improve your system overall. But you got to get almost 150 to 200 grams of protein. And so I know that sounds like a lot, but when your body is stressed in a surgical event, that's what it needs. That's what it craves. It's not bread. It's not pasta. It's not carbs. It's amino acids, which are the building blocks of protein.
Right. I mean, it's amazing to me because I've worked with functional MDs for over a decade now, and it doesn't matter. Like, if someone has a knee replacement, if this is my first time talking to an expert around breast explant surgery or capsulectomies or anything regarding aesthetics, but everything from knee replacement, hip replacement, you're having a C-section, you have an autoimmune disease, the amount of times that there were supplementation of amino acids specifically is pretty. It doesn't surprise me that you've included it in an explant surgery, just because healing is healing for the body, and you need amino acids to heal.
And I think you mentioned the ortho. Like, to me, it is the most logical group to go in that direction. They're a super smart group that's really motivated to help and also is embracing regenerative medicine. So they should be the group most interested in the SHARP method to help their patients, both preoperatively, but then in the rehab postoperatively, get the swelling out faster and recuperate more quickly because it's a joint. I mean, you don't want to have any joint get a problem ever. You don't want to have delays in healing with skin breakdown. You don't want to have a swelling issue. So that everybody listening, the reason I am the hack, if you will, is to get the protein high enough in your bloodstream so that the fluid that's in the tissues causing the swelling is drawn out of the tissues into the bloodstream. And then your body will process it out and you'll filter it and pee it out. The reason we use lymphatic massage is we're kickstarting that process by, instead of 1,000 hands lymphatic massage, we have a device that efficiently will do it over about a 45-minute window in the office. And you'll typically have to get up and go to the bathroom. You're like, oh, that's weird. But it's helping your body naturally, up level what we want you to do. We want you to get the fluid out as quickly as possible. And then if I get another person who rolls into my office drinking out of a plastic water bottle, I'm going to throw a fit. Don't drink out of plastic. And if you're our patient, we want the water to have a nutritional value to it. So put a scoop of our aminos in it or protein powder. And this is not about how good it tastes, because most of these things don't taste great. Mm-hmm. But the extra amount of fluid will make you puffy if it doesn't have any nutritional component. And adding electrolytes does not improve nutritional component. We want to regulate the protein in the bloodstream by getting more amino acids and protein into that environment.
It makes perfect sense. So if someone can't access your office and they're looking to do an explant surgery, it sounds like, the checklist I have in my head is to, get your mind right on it, align with that this is your future and this be in alignment, that's what you want to do. Get your blood drawn, get your genetics done, look at your detox pathways, MTHFR, make sure you're on a supplement to support that, I'm assuming a methylated B complex to support that as well. You're upping your protein, you're decreasing dairy, gluten, and seed oils, removing those from the diet. You're focusing on sleep and movement. If you don't have access, obviously, to your office, lymphatic drainage makes sense to me. Even just like a walk to get lymph moving. Is there anything that we should be aware of? No plastic bottles. That makes sense to me. Pulling all of the endocrine disrupting chemicals out. We're just lowering that overall environmental toxin burden so that you can heal. Is there anything sneaky or something that you are really a proponent of that we wouldn't see online or that someone wouldn't know to do that we talked about today, that is an added benefit to help them heal?
We have all of it out there that is outlined. I don't try to hide anything. I've put it all in my book. I've put it all out online. I think the future of this is the science helping identify more of those molecules that are driving the inflammation. I feel like that's a huge important next step. I can't drive that. I think looking at intrinsically why our stem cells behave a different way and trying to leverage stem cells and exosomes to augment fat transfers or healing in general are next steps, but our country is a bit backwards on that. So we want to make progress there. And then I have another surgeon, Dr. Thomas Chung, has joined me and is aligned with how we do everything in a holistic way. So if someone can't work with us, but wants to run our detox program, they can do that. That's scalable. So if someone says, I can't travel, which we completely understand, the next best situation, because as you would imagine, Kelly, the majority of the offices that do plastic surgery are not going to have the interest, ability, understanding of what we've been discussing. So it's not, if they can provide the surgical service in a competent, safe, effective manner, then that's great. That's a start. And then the programming, my book, my detox group, our supplementation, those will all support the patients after surgery. Many surgeons will kind of it's like a program in your head. Well, we have to stop all supplementation, as you would have been told when you were working 2 weeks before, and don't start them until designated afterwards, blah, 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 blah. Well, most of that is bullshit. So my patients stay on supplementation from the time I speak to them for the full year. I don't pause anything because we've taken great lengths to balance out everything in the line. So people are not getting super normal levels of any antioxidants. Mm-hmm. So that's one thing. I don't stop supplement. I really want that on board. Mm-hmm. And we do a lot of specialized nerve blocks and preoperative treatment before we ever go back to block pain. So our patients' pain scores are much lower, which obviously makes the use of narcotics much less, which really helps recovery. So if you can get, to us, phenomenal. I have patients come from Asia and Europe and obviously all over the United States. But if you can't, then you can run the programs, and that will really, by virtual extension, you'll work with us.
That's great. So with the SHARP program, it sounds like the SHARP program would work for any type of surgical recovery. You
could use it for longevity too, because obviously what we've been talking about is reducing chronic inflammation. For everybody listening, the number one killer is still a heart attack. You got to get rid of hard plaque. So doing a CIMT study, really you got to focus on things like that for longevity. For increased health span or improvement of health, doing my program will help that, because it's all about lowering inflammation.
Makes perfect sense. This has been great, Rob. I really appreciate your time. I mean, like I've said, I've seen Explant announcements on Instagram from friends, and I feel like this community, I'm serving this community and them understanding if they have implants, what their options are, what it looks like, where the fat transfer goes, like how they heal, what to expect. I hadn't even thought about Lauren being in a sauna with her implants, but that's...
Yeah, pro tip. If that's the case and you feel bad after sauna relative to your peers, so if you're in there with your girlfriend who doesn't have implants, or if you're in there with your spouse who doesn't obviously have implants, I hope, then you need to pause that and maybe you get a hold of us and I can have a conversation with you, because you may be leaching chemicals into your system. This is not a new phenomenon. Just think of the plastic water bottle getting overheated and producing the phthalates into the water, or they come into the water and you drink the water. I mean, none of this is that complicated.
Right. Fascinating. Well, thank you so much for your time. Where can people follow along? Where can they learn about the SHARP program? Where can they grab your book?
So I would prefer that everybody go to our YouTube channel. Just search Dr. Robert Whitfield or breast explant surgery. I'll pop up. All the links to everything are there, including the paper we just published, how to get our book, how to get our supplements, how to get involved with us, where to listen to my show about explant surgery. That's the best way to get us. Plus, all the social media handles are there.
Great. I will link to that in the show notes. Everyone go follow along if you are interested in this type of a journey. I hope this has helped you make that decision to pull those implants out of your body. Let's explant them. Let's get them out. Thanks, Dr. Rob.